Ipsos polling exclusively for Global News shows 72% of Canadians would take the COVID-19 vaccine as soon as they possibly could. That's up a whopping 20 points since November. 64% say the vaccine should be mandatory. That's also up some 5 points since November. When it comes to who should get it first, 82% say those at social and economic disadvantage in areas with high caseloads should get the shot. But we're not holding our breath. Most of us believe we won't be eligible to get the shot until the spring or summer, and 18% think it won't happen for them this year at all. Some people are still hesitant, with 15% preferring a wait-and-see approach, potentially holding off on getting vaccinated until 2022. Despite the slow rollout, 79% of us are optimistic the vaccine will be effective at slowing the spread.
Well, I think the first thing is that people realize that vaccines are going to be an important part of getting us back on track. So fighting the disease, but also getting the world back to the way that it needs to be. Vaccines are an important element of that. The second thing, though, is that even the reason that it's not 100 is that the public is really not quite there when it comes to people having something other than their own choice to get a vaccine. So whenever you make something mandatory, sometimes people's sensibilities get a little, I would say, fragile. They state control on something like that. There's a significant part of the population that has a problem. So even though that number has gone up, it has not gone up as much as one might expect. It is interesting when you take a look at the percentage of the people who say that they absolutely won't get a vaccine, it's actually quite small. It's down to, I think what we found in the survey, it's roughly around 10%. So the other 90% of the population is considering it on their own getting it. Now their sense of timing might be different on it. They may be waiting to see what happens to more people in terms of side effects, but the intention among the public is larger than we've seen for anything like the flu vaccine, which tends to be much lower. So obviously people are taking this seriously. They're really considering it. Support for the idea of personally choosing to get vaccine has gone up even more than it has for mandatory. So support for people actually saying, I will get a vaccine when it's available is now up to 72%, and it's gone up 20% over the space of the last few months, and that's a huge number of people. If all 72% of the population got that, that would be a population of about 27 million Canadians saying that they would want to get a vaccine for them as soon as it's available. That's a huge level of demand. The two biggest barriers that people had to getting a vaccine previously were, first of all, concern about side effects. They wanted to go through a certain period of trial, seeing other people getting the vaccine before they would take it on themselves. The second thing was that they felt that this process was very quick. They were told, I would say, by many people, health officials and others, that this was an exceptional circumstance. So they were worried about side effects, and they were worried about potential longer-term consequences because what they perceive as a bit of a rush. But now as they're seeing people get the vaccine, they're seeing this rolling out in other parts of the world. They're seeing that there aren't significant side effects, at least so far. A lot of these considerations and concerns have been knocked down, and people are so tired right now of being boxed up in their apartments and their houses, not being able to go out and meet with their loved ones over the holidays, now going through in Canada many circumstances of a second shutdown, that they're prepared to take the risk. So that's what we've seen. We've seen a transition in the barriers that people have, and some of them being reduced with experience. And the second thing, a real growing desire, very strong desire to get their lives back. Anytime that you say anything is mandatory to the public, they would rather have the choice. But the bigger question that we're going to be dealing with over the space of at least the next 6 months is availability to even come close to meeting the demand that we have among the population. So whether it's the actual access to vaccine or the ability for provincial governments to distribute the vaccine, keeping up with the increasing demand that there's going to be among the Canadian public, and we're seeing it right now, to have access is going to be the really big challenge. actually demanding that people do that, it's a what I would call a last mile type consideration. It's what you have to deal with at the very end of this. Right now, it's staying up with the growing demand that we're seeing in our survey results. So the government came out and said, well, we think we're going to be able to vaccinate most Canadians by the fall. Well, that's their expectation. That's what the government has said about what it feels is reasonable. That's not what the public has said that they feel is reasonable. And what we're seeing, I think, in the survey data is the expectation among Canadians is that most of them will be vaccinated in June, not in September. So there's a big gap that the governments, both provincial and federal, are going to have to deal with when it comes to what Canadians are expecting. And as the pressure grows as a result of what we're seeing in the United States, for example, if Joe Biden's actually able to deliver on his 100 million vaccinations by the same time frame, we're saying we're going to have 3 million people vaccinated. That's going to be a very interesting set of pressures that are going to be confronting the government, because that's very much going to be trailing what Canadians think at this moment that they're going to have access to. It's surprising to see that people's willingness to travel and go to crowded events, even though it's still relatively low, is somewhat higher than their expectation that the economy will get back on track. So that's a really interesting finding, that people are seeing that vaccines are coming on. They're seeing that potentially we could be getting back to some form of normal life, but they continue to be concerned about the ability of the economy to recover.